I'm Ron Saunders. I am a member of the steering committee, and I'm going to be providing a brief overview of the revised strategy document. But I should emphasize that this conference is not about fine-tuning the strategy document. That's something that we've done together with you since the last conference through consultations. It may be fine-tuned down the road, but this conference is not about further fine-tuning of that document. This conference is about working with you to develop a path forward, working with you to figure out how to implement these initiatives, working with you to determine how we can really affect change and make things better, okay? But I think it's important as a starting point to review where we got to with the strategy document. Alec already mentioned, the hosts, the organizations that comprise the Disability and Work in Canada Steering Committee, and that effort has been supported by the Government of Canada, by CCRW, by the Centre for Research on Work Disability Policy, and by the Social Sciences and Humanities Research Council of Canada. We also have sponsors for this conference, the platinum sponsor, the International Union of Operating Engineers, and we have sponsorship from the Canadian Building Trades Unions, BDC, the Workplace Safety and Insurance Board in Ontario, Prevention Link, the CSA Group, and Work United Canada Council. So the goal of this initiative from a couple of years ago, right, has been to develop a vision and strategy for increasing the employment of persons with disabilities that will inform and guide the efforts of governments, employers, and other stakeholders. The objectives for this conference to build engagement and momentum for implementation, as I said a moment ago, to identify the most important early steps in implementation, to facilitate collaboration as we move forward, to identify important gaps and challenges that need to be addressed in order to implement the strategy. The purpose of the strategy document, again, was to provide a kind of high-level strategic framework for all the key stakeholders that identifies collaborative activities to increase the employment of persons with disabilities in Canada. So in revising the strategy document, as I said, we held fairly extensive consultations over a period of several months. There were really two parts to the consultation effort. One part was meetings with people. Some of those were group meetings. Some of those were with individual organizations or individuals. There were about 370 people across the country who attended consultation sessions, and they were held in almost every province. We also conducted a survey. There was a survey where individuals could provide their advice and input. Over 400 people participated in that survey. So between the consultation meetings and the survey, there were over 800 people who participated. Now, there may be some overlap, but people who went to the consultation meetings and also submitted a survey. But in total, over 800 responses, in a sense, through the consultations and through the survey instrument. And out of that, we made a number of changes to the strategy document. And we changed, for example, the wording of the vision statement. So the vision statement now reads, employment throughout Canada is inclusive. Persons with and without disabilities have equality of opportunity and choice. That's new language. Equality of opportunity and choice in careers, jobs, and work. Okay? The overall structure of the strategy, as you may recall, the idea is that there are key pillars, key areas of activity. They can also be thought of as key objectives of the strategy. So there's the two key pillars now. One of them focuses on the workplace and the other on individual persons with disabilities and the supports provided to them as individuals, right? And that we want workplaces to be disability confident. I'll explain in a moment what we mean by that. And we want there to be comprehensive and adequate supports for individual persons with disabilities. Those are sort of the two key pillars of the strategy. We have a foundation for that being effective partnerships. We need effective partnerships to make that happen. We have overarching principles, core values, that guide the entire strategy. And we have areas of activity that cut across both of the pillars, that is measurement and accountability. For example, cut across both of the pillars, attention to intersectionality, to multiple sources of disadvantage, cuts across both of the pillars. So we now have these two, as I mentioned, two broad areas of activity: disability, confident, and inclusive workplaces. And what do we mean by that? That businesses, employers will understand the value of and be committed to hiring, managing, accommodating, supporting, and retaining persons with disabilities. And they will be confident in their ability to successfully do so. The second key pillar, again, comprehensive supports for individuals, that persons with disabilities will be supported in their pursuit of meaningful employment while assured of income and benefits that provide a life with dignity above the poverty line. As I mentioned, there are overarching principles that guide the entire strategy, that guide our efforts going forward. So briefly, there is adherence to the United Nations Convention on the Rights of Persons with Disabilities. So that is fundamental. Respecting the rights of persons with disabilities not only as individuals, but as well the vital role of collective commitment to their inclusion and support. To adhere to the principle, nothing about us without us. Persons with lived experience need to be involved in all phases of this work. To adhere to federal and provincial and territorial legislation dealing with human rights, accessibility, and employment, to develop effective partnerships, and to apply an intersectional lens, that is, again, to recognize that there may be multiple sources of disadvantage, right? We may have combinations of people who have a disability and also face disadvantage, say, because of indigenous status or sexual orientation or gender and so on. And to take a life course perspective as we think about, you know, the initiatives that need to be implemented. And what we mean by that is that we have to recognize that people's needs may evolve through different stages of their lives. And we have to ensure, for example, as people move from school to work, that they have the right supports that they need in order to make that transition successfully. Okay, so I'm going to briefly review what are the key initiatives that are proposed in the strategy document under each of the pillars, and also in the cross-cutting foundational activities. So first of all, the pillar that's about workplaces, disability, confident, and inclusive workplaces. The key initiatives that we've outlined there, again, taking into account your input. First of all, to provide supports to businesses and employers for recruiting, hiring, onboarding, and accommodating workers with disabilities. To design these supports so that they can be tailored to the context of the employer, to the size sector of the employer. Examples of what these supports might include: tools for senior managers, supervisors, co-workers, tools for building the business case of why inclusion works not just for the people being included, but works for the organizations that are becoming inclusive. Documenting case studies of success, providing financial incentives based on evidence of what kinds of financial incentives are actually effective. To provide a one-stop shop for businesses to access supports, so because we've heard that sometimes it's hard to find where the supports are. To promote understanding that disability is based not on, disability involves a combination, right, of a person having a condition or an impairment with the social and built environments. Disability is about the interaction between the person and the environment. And so what we need to do is provide an environment that is inclusive. To create, and as part of that, to help workplaces do that, we are proposing a center of expertise on accessible and inclusive design. Inclusive design being about more than the built environment for workplaces, but about workplace practices, okay? To communicate how everyone benefits from inclusive design, to identify champions who can promote best practices, and to create supports for persons with disabilities who are interested in starting their own businesses and becoming entrepreneurs. Okay, so that's the workplace-focused initiatives, okay? Then we have the initiatives that are focused on supporting individuals, people as individual persons with disabilities. One of the things we heard in the consultations is that avoiding poverty is the most fundamental thing, right? So we tried to give that more emphasis and move it up front. So ensuring that income support is adequate to avoid poverty. Ensuring that earnings exemptions are sufficient to encourage pursuit of employment. What we mean by that is that the earnings clawbacks should not be punitive. We don't want people punished as they move from income support to employment. Ensure that persons with disabilities have access to affordable housing. Unbundle income benefits and employment support. So if people move from income support to employment, they retain the employment supports they need to be successful. Provide better transit services, affordable childcare, universal pharmacare. Now, of course, some of these things are things that would benefit everybody. But we heard in the consultations that these things are also critical for persons with disabilities. And so we've added them. These are things that have been added to the strategy document, the references to transit, childcare, pharmacare. Other initiatives under this pillar to reform the array of government programs so that the system becomes user-friendly, coherent, easy to navigate, inclusive, because we know that currently it can be very difficult to navigate across different programs. Ensure that programs support an intersectional view. I've explained what we mean by that. To provide resources that move with young people into adulthood, to support the school-to-work transition. To provide resources to help persons with disabilities communicate with their employer about how their needs can be met, to support communication in the workplace, and to address stigma among program officials so that providing adequate benefits is prioritized over caseload reduction. We're going to have a session that talks about what can be done to avoid, prevent stigma, prevent unconscious bias. Okay, another area of activity that underpins all of the work on all of the strategy is the need for partnerships, right? And so some of the things that need to happen in this, in the theme of partnerships, that first of all, again, first and foremost, that persons with disabilities are fully involved and integrated in all key activities, that governments of all levels, including municipal governments, First Nations communities, work together in partnership with all other stakeholders towards a more inclusive, supportive system. That employer associations, business champions, and unions work together to promote a culture of inclusion in workplaces. And governments set an example for businesses as employers. The governments set an example as employers. And that educational institutions work with stakeholders to better support the employability of persons with disabilities over their life course. We have one participant not sure about that part of the strategy. And also under partnerships, that researchers should work with all stakeholders to identify and address evidence gaps, knowledge gaps, document case studies of success, and assist in the evaluation of new or changed programs. Partners ideally should have a focal point for connecting with each other. We're going to talk more about that over the next couple of days, and partnerships need to be reviewed on an ongoing basis. Another area of activity that cuts across all of the work, we're going to have more on this tomorrow morning, and it may come up in other discussions, of course, as well, is the whole area of measurement and accountability, the importance of an outcomes framework, and we've identified a number of possible indicators that need to be measured, indicators that relate to employment, that relate to earnings and poverty, job satisfaction, not just being employed, but whether the work is satisfying and whether it is long-lasting, the duration of employment, wellness, progress towards an inclusive culture. How do we measure what an inclusive workplace culture is? Can we measure it? Can we measure progress towards that? Marginal effective tax rates, that's about not having punitive clawbacks, right? Making sure there's not punitive clawbacks. Perceptions of persons with disabilities about the adequacy of income and supports. In other words, we are interested in the subjective views of persons with disabilities about how well the system is working for them. And measures of educational attainment and the school-to-work transition. We need to collect data in ways that facilitate further research by, for example, by linking data sources and establishing a baseline, right? We need to know where we're at now so that we can be able to measure progress. So it's important to be measuring the baseline of these key indicators. We need to develop measures of disability confidence. We need to identify the gains from inclusion to the public and private sectors so that people can see the benefits of this move towards inclusion. To develop a reporting plan to promote accountability, to create a repository of initiatives and resources that have worked well, a place where people can go to find resources that have been found to be effective. Create a guide for the evaluation of new initiatives, and again, to tell stories of success. Lastly, I'm just going to mention in a couple of slides a very high-level principles around implementation, but this whole conference is going to be about exploring that in much more detail and getting your input, right, on how we move forward, how we make things happen. Implementation of the strategy is on a voluntary basis. I know some have found that word contentious, but it is sort of necessarily so because we're a bunch of nonprofit organizations. We're not in a position of power to require people, to compel people to follow through. What we're trying to do here, though, is build consensus across all the stakeholders, build buy-in so that change happens, okay? And we also recognize that while we talk about implementation being voluntary, that government legislation may be a part of it, has been a part of it so far, right? Like the federal accessibility legislation. And so there may be elements of this as it moves forward that require people to do things because there's government legislation or regulations or standards behind it. It's critical to ensure that persons with disabilities with diverse lived experiences are represented. We've talked about that, and it's going to be fundamental in every aspect. There is a possible role for the little DWC steering committee to remain involved, but perhaps with a bigger stakeholder involvement in monitoring and reporting on progress. There's the possibility of further annual conferences or policy roundtables. And of course, key partnerships will need to be established and strengthened. Lastly, ideally, but this requires resources, there would be a center for expertise with the full involvement of persons with lived experience and frontline employers that could do things like provide a portal with links to evidence-informed tools, resources, and services, a place, a one-stop shop you could go to with links to where you can find tools that we know are effective, right? It could also support further research to address gaps in those tools and resources, to develop new evidence-based tools and resources, to promote inclusive design, to monitor progress on the strategy, to provide examples of case studies, to provide resources for building the business case. We also will need to connect with other related strategies. If there's a housing strategy, we want to make sure that it's a housing strategy that's sensitive to inclusion, disability issues, right? And resources may be needed for various aspects of this, and we'll talk about that over the next couple of days. I think that is it for now. Thank you.